Welcome to Eye Contact, a video news program on issues and controversies in ophthalmology sponsored by EUROTIMES. I'm Henahan. While all ophthalmologists should be good physicians, they also need to be good managers to ensure that their patients are satisfied after every procedure. Today we're talking to Kris Morrill, the co-program manager of the ESCRS Practice Development Program. Hi, Kris.
Hi, Sean.
You have worked with the ESCRS on their practice management and development program since the beginning. Why is this program important?
It's important because the healthcare landscape in Europe is changing, and it's changing very rapidly. And you're seeing governments looking for ways to control costs. You're looking for governments to reduce the amount that they spend on certain procedures, like cataract surgery in particular, is a big target. And so doctors are going to have to be less reliant on public money and more than likely more reliant on private pay, private health insurance, and that changes how you have to manage a practice. And managing a practice is managing a business, and I think a lot of times doctors are ill-equipped for that because they are trained to be doctors, and they are very good at that, but they're not so great at balancing the books, understanding the overhead, human resources, and all those issues. And that was really the guiding spirit of why the ESCRS created the practice development program back in 2008.
You've worked with ophthalmologists all over the world and shared your marketing expertise with them. It could be argued that ophthalmologists, like most doctors, don't really understand how marketing works. Have you found this to be the case?
I've found that to be very true. The story that I tell a lot is a few years ago I was invited to give a talk at a company symposium at a country meeting. And at lunch, this doctor sat down next to me and he said, I've been to all of your marketing talks. And I said, that's great, thank you. I said, have you ever implemented anything? He goes, no, but I enjoy your talks. And every year we ask for shows of hands about, how many people have taken what we've done the year before and implemented in their practice. Over time, doctors are beginning to pick up and realize the importance of this. But I think marketing is one of those things that it's the first thing that gets cut when money gets tight. Mm-hmm. And they don't think about it as really a necessity of practice development and how you grow your practice and grow awareness about your practice. And so I think that is an ongoing challenge that we at the ESCRS have to continue to address. I think like the master class that's taking place here in Copenhagen on marketing is going to be a great day and a great example of how surgeons can think a little bit differently, use online marketing, etc., to grow in an organic way that doesn't cost the earth.
Have you found, working specifically with the European ophthalmologists, that there are some cultural obstacles or some resistance to some of the ideas that might be very popular in the States or elsewhere?
Well, there's not so much cultural resistance as there is resistance due to legal barriers. And in most countries in Europe, there are limitations about how doctors can market, advertise, etc. And so oftentimes they don't think about ways to grow awareness around those barriers or outside of those barriers or those legal requirements that they have to do. And so I think that's it more than anything else. I think that European ophthalmologists are in general less marketing oriented, but that's probably partly because of the public healthcare systems. And you have a ready catchment of patients, you have the payments that are set, and so you're not having to worry quite as much right now about attracting new patients. So I don't think it's social, cultural thing as much as it is just the market environment.
Well, let's talk about something that's dear to your heart, social media. Most American ophthalmologists I see have pretty savvy about having a website and Facebook and so on. What can European ophthalmologists do to take advantage of social media for reaching out to patients?
Well, I think social media is a great economically friendly way of getting out your message and communicating to patients. Facebook is probably the first one that they'll look at after a website. Done well, it can be a great way of engaging patients, encouraging happy patients to talk about your practice for relatively low cost. Twitter takes a little bit more of a finesse because you have to do what we call engagement. And at the presentation that we've done here in Copenhagen on social media marketing, we're going to be talking quite a bit about how to engage and how to have conversations with people who follow you on Twitter, follow you on Facebook, so that you start to have a conversation and people see that your practice is alive and dynamic and someplace that they might want to check out.
Now, wouldn't you recommend that physicians have a look at Google themselves, because they may not be aware that there might be some negativity out there, or who knows what? Isn't that the first step?
Absolutely, and that was something that Caroline Anderson, the co-presenter, and I discussed when we were working on the presentation, because I had very much in my mind that was something that you would only find in the U.S. And then I quickly Googled a couple of ophthalmologists that I know in Strasbourg, France, where I live, and sure enough, there were Google reviews. And sure enough, they were from some unhappy patients. And those are always the first people who are going to post a review. So yeah, it is very enlightening to type in your practice name or your name and see what comes up, so that you have an understanding of what is out there about you and your practice.
So take charge of your destiny.
Absolutely. Absolutely. Great. You have to be in control of it.
Thank you for joining us.
Thank you.
Thank you for joining us. For more information on this and related topics, please visit us at eurotimes.org.